Well, we do it on the back, down the spine and round the scapulas, and so down the sciatic nerve. Poor Margaret, I can see her still doing it. She had very dark hair, and hers was up like ours. Yes, and we did that. We did a lot of frictions, and frictions around the knee, and if you're treating an ankle, you'd use a lot of friction to break up the fibrositis, the thickening of the tendons or the muscles that had got abnormal thickenings in it. And I think it worked. Well, we did all the different kneading and butterflying and different things, and I used to do hacking and clapping a lot on the babies. I even was treating the babies in the incubation things that, you know, you just use a finger or two fingers. They're like, you know, they're all attached up to things that you couldn't move them around as much. But one day I was doing it at National Women's, and there was a doctor came, and he had put his hands in and helped. He said, "I think it's going blue now. I think we better stop." But you know, you could only turn them a certain amount. But doing chests was a big feature of the work at National Women's, because you have all these very thick chests of the island. The Polynesians have very, very thick chests, and a lot of them smoked, and a lot of them had bronchitis. And I remember I had a lady who'd had because the cesareans were done like that, and the doctors used to sometimes ask us what did we think of the chest, because if we were treating the chest, you could hear the crapes and you could do them. And this woman had broken her stitches through coughing because she was smoking, I suppose. And I had to treat her in the theatre, which I hate, speaking of theatre. And I can't remember who the surgeon was, but they had to restitch her, you see. And so he said, "You'll just do it the same as you would if she wasn't sedated." So she was huge, and she was, you see, we had to move her. You know how you lie them on one side and then the other side. And she was a huge woman. And I had to do it while she was in but they did rely on people that had been treated. And one time I was on duty on a Sunday, and you had to do the whole of National Women's yourself on a Sunday. And there was somebody in a side room who'd needed special treatment. I can't remember what it was, whether it was a chest. Yes, it was a chest. And she might have had stitches. I can't remember anything much about, except that she had a grotty chest. And I was supposed to treat her 3 times a day. And I said to the house surgeon, "Would you ask her to stop smoking?" And he said, "I'm not going to play God." I said, "Well, I'm not going to treat her. I've got the whole hospital to do." And we used to pre-op all the patients, and then we'd go to them, you know, the gynae patients and who were having surgery, and then when they came out, we'd get them going on their breathing and their exercise, moving the feet, tummy on the tummy and everything. They knew, you know, because we'd taught them before.